Okay, good afternoon, everyone. I'll call to order the Winnebago County Community Mental Health Board, Wednesday, May 3rd, 2023. And at this time, I'll take roll call. Mary Ann Abadi present, Dr. Ed Copeland, who will not be with us today, Dr. Terry Giardini,
Here.
Dr. Bill Gorski,
Here.
Dick Cooner,
Here.
Wendy Larson Bennett, Tim Neighbors,
Here.
Linda Sandquist here. Mohammed Yunus.
Yes.
Mohammed, just real quickly, since you are brand new to the board, do you want to introduce yourself and just give a little knowledge about your background? We've all read it and so forth, but hearing it from you is even better.
Sure, I'm more than happy to. My name is Mohammed Yunus. I've been teaching at Institute of Phoenix, John Mayer College of Business since 2003, and have published around more than 10 business articles. From 1991 to 2005, I was the CEO of Single Mental Health Center. Then it's hospital administrator from 2005 to 2012. In 2012, I was appointed by the then U.S. Secretary for Health and Human Services to serve on SAMHSA's National Advisory Committee until 2017. And I was appointed to serve on Evaluation and Improvement Council of Institute of Phoenix in 2000, from 2015 to 2016. I reviewed grants for Health and Human Services Access to Recovery Program in 2004 and again in 2007. And I was a panel member of the Higher Learning Commission of North Central Association of Colleges and Universities. This is my brief introduction.
Well, now that is quite a resume, I would say, and we are very honored to have you as a new board member. So you will be able to get to know.
I'm very happy to join this group.
And I remember Mohammed because he worked at Singer when Dick Cooner was the administrator at Singer many years ago. So
He is the one who
he hired you at Singer. Yes, yeah. No. Well, what goes around comes around now. Well, thank you and welcome. Next on the agenda, we had no request for public comment, but we do have a presentation today by Lightscapes. And I want to, first of all, welcome Jason Holcomb and Chelsea. I always say it wrong. And Nicole Bennett, they're staff for us at R1. So we couldn't do what we do without them. So thank you all. And the presentation, I'll let Lightscapes introduce themselves. And you're very fortunate because for the first time, we now have a clicker for your slideshow. So you can move it ahead at your feed.
And feel free, if you want to utilize the podium, you can pull it from the wall. If
Yeah.
you don't want to utilize it, that's okay too.
I think I'll stand in this corner so I can we'll spread out a little bit. Well, thank you for having us today. I'm Joy Drysdale. I'm the Program Services Director with Lightscape. I have the privilege of overseeing the program, the senior mental health program that we began. We're in year one, obviously, and we were awarded $150,000 towards it.
And I'm Krista Ryder. I'm the Senior Mental Health Program Supervisor. That way. Got it. All right. So Lightscape's been around for a while. And most of you folks have probably heard of us. You know, we're mostly known for like our Meals on Wheels and things like that. So in providing services, we noticed that there was a gap when it comes to addressing the mental health needs of older adults. And so we applied for the grant and we're specifically targeting depression in older adults. So our mission is to assess for depression. We're educating folks about what depression is and that it is not a normal part of aging. And we're referring them for support and for services as needed. So our target population are folks 60 and older who have a major depression disorder diagnosis, or they're exhibiting depressive symptoms. Older adults who are displaying the depressive symptoms. Older adults have the highest suicide rate in the country. Aged 85 and older is the #1 category. And then the next one is 75 to 84. Demographics, most of our clients, 92% of folks are already on antidepressants prescribed by their primary care physician. Most of them are not connected with a counselor. And so that's kind of because of, not being able to connect with one on their own, or like the gap in services, they're just not available and they don't know how to access services. Socialization is one of the goals that a lot of our folks pick, and physical activity. So kind of recognizing, like, I need to get out, I need to do more, I need to be a little bit more active. Folks are usually about 71 is our average age, and most of our clients are divorced or widowed. Geriatric mental health. So this is such a unique population. There's a lot of things happening as folks get older. Physical issues, a lot of life transitions, maybe selling your home, financial issues, needing to move into assisted living. There's a lot of changes going on. And our program is only one of its kind in Winnebago County.
So as a staff, we're extremely cultural competent and trauma informed. Our staff is well skilled and qualified in these areas. We see trauma with older adults on a daily basis, not just trauma they deal with as an older adult, but throughout their lives, maybe as a young person too. So this is highly on our radar all the time. We are also mandated to report any abuse, whether it be physical, financial, and such. So we're always, again, looking out for that. We also know that transitioning through levels of care can be traumatizing, whether that means losing the ability to drive, maybe dynamics in their family have changed, all kinds of different things they may face as an older adult. So we had a general initiative that we included in our application, which is in the booklet as you follow along, called Working in Partnership and Hope With You. And that is an initiative we hope to do outreach to low English proficient speakers amongst the older adults, where we will include language interpretation services, which we've been utilizing, but hope to increase that, and also brochures in other languages that we make available.
So our priorities, our program addresses 3 areas of the community support system. So 40% of our time is spent in client identification and outreach, 10% is spent with family and community support, and 50% is spent with case management. In that case management, that's helping folks find appropriate services that they need. Our reputation has really opened a lot of doors, and I'm able to call places and say, like, hi, I'm from Lifescape, can I tell you about our program? And folks are like, yeah, Lifescape, sure, come on in, come talk to us. So that's been a great strength. Our places, we literally meet people where they're at. So if that's in your home, we can come to your home. If you're in an assisted living facility, we can come to the assisted living facility. Folks are welcome to come to our offices. We have transportation. So if, they don't have a vehicle or they don't want to take the bus, we can have someone go pick them up and bring them in for their appointments. So starting the process, we used evidence-based screening tools. So let's say somebody might be interested in our program. And so we would start with a screening. We use the patient health questionnaire, we use the UCLA loneliness scale, we use the PHQ-9, and those symptoms there align with the DSM manual. And so that'll help us kind of see what if they're, moderate depression, mild, or severe. And then we also administer a STIG-9. And so that one helps address the stigma and the misconceptions that go along with mental illness. And so we like to see where folks are at in the beginning of our program and at the end to try to see if we've kind of changed some of their thinking around that. So our process, so if we've screened someone and they're interested in our program, our first visit would be going out to where they live, and we would do the registration and the enrollment process. And our program that we use is an evidence-based curriculum called Healthy Ideas. And so that program tries to get folks to see the connection between our activities and our mood. And so, for example, if you're living in an assisted living facility and maybe you've stopped going down to eat in the dining room because your symptoms have just gotten so bad, and so you isolate, so then you feel worse, so then you stop doing more of the things that you used to enjoy. So we would sit down with the person and come up with a goal. So for example, the dining room one. So maybe this person wants to try going down to the dining room. Okay, so what are some of the barriers? What's stopping you from going to the dining room? And we would come up with a plan, we encourage them, and then hopefully they go down to the dining room and then they start to see like, okay, I feel a little bit better. And we just kind of work with them and we keep encouraging them to meet some of these goals. And hopefully, like I said, they start to feel better. Kind of going along with that, if somebody feels like they want to communicate with their doctor and let them know these things are happening, maybe I need medication, with a signed release, we can advocate for them. We can role play with them on how to talk to their doctor. If they want to receive counseling services, we can do that. And the way we have it set up is that it's a warm handoff. So it's not like, okay, here's the number, you go ahead and call. A lot of our folks, maybe aren't able to advocate for themselves. Like I said, maybe they don't know where to call, they don't know where to go, they don't know what to ask for. And so we're there to kind of help them. We have relationships with other organizations and we can kind of help connect them. Our program can last anywhere from 6 to 9 months, kind of depending on the need. And at the end, we reassess to see where their symptoms are at the end versus at the beginning. Throughout the process, what I like about this program is that we can kind of tweak it to the need of the individual. And so some folks don't like talking on the phone. They just prefer to talk about things face to face. So we're able to do face to face, or if they prefer, we can do it by the phone. And so we can still make those changes, but still maintain, the validity of the program.
So these were our initial goals we set with the Healthy Ideas program at the beginning of the funding year. And I'm happy to report we have performed 228 depression screenings out of the 500. We have 34 suicide risks, 15 in the Healthy Ideas participation, and 4 that have reported a perception of care change. We also, alongside of that, gave education in the mental health field arena to 328 older adults, while 58 qualified for the program through the screenings that Krista has spoken about. 15 agreed to enroll into our program. Our budget is pretty much on track. I'll cover some things through the SWOT analysis coming up in a few pages in your booklet. We're a little below target on the expenses for personal salaries because we just experienced someone leaving us for a little while before we were able to replace that person, but pretty much along the rest of the line items we're on target.
Okay, our results. So if our clients report a decrease in depressive symptoms, the average reduction in symptoms, they report that 2 or 3 of them kind of dropped off or went away, and reduction in the mental health stigma scores.
So these are some of our partners we partner with. I won't read through them, but we fortunately within our agency too receive a lot of referrals. And we're able to partner with these folks too, whether it be referring to them or them referring back to us. We're also very committed to this program. We have always been strong participants in all of these extra items that we participate in, and we've always been timely with our reporting, acknowledging WCCMHB, and of course, we were excited about the mental health fair coming up Fridays.
Some of our client testimonials we put up here, the response has been very positive. Folks that have completed the program, like having somebody there to talk to, having somebody to help advocate for them and connect them with services. Even going out and doing like outreach events. It's been very surprising to see folks kind of sit there and nod their head when I'm talking about symptoms, or I've had folks raise their hand and say, I have depression and I'm on medication and it's okay to talk about it. And then other folks have brought up like, you know, my mom was in Singer, and talking about the stigma and the shame that brought onto the family and how they struggled with stigma for something that's a medical condition.
So even though we were only given 10 minutes, I want to spend a little time with our SWOT analysis, because this really brings home to what brought us to the proposals that we applied for. Our strengths, again, as Krista mentioned, Lifescape is in contact with more than 5,500 older adults annually in Winnebago County. We have wraparound services within our agency that we receive referrals from, which is very helpful. And of course, we refer them. Again, if they're socially isolated, if they need to get out more, if they need transportation, all of these things come into play within our agency. And then, of course, we are experienced with the data collection, so that has been a ease of reporting for us. So weaknesses are, again, the lack of mental health providers specializing in older adults, Medicare recipients, lack mental health professionals also. So those are some weaknesses in our program. The opportunities that we have in front of us, which we're excited about. I mean, obviously there was an evident gap in mental health services for older adults, so this, we feel, help fill that gap. We also, with our skilled staff and credentials amongst us, feel we can even enhance our competency even more. And COVID-19, of course, revealed isolation, so we're able to enhance that as well and offer more services to that now that it's more revealing. And we are finding as we go out and do outreach, there's some transparency and engagement amongst older adults, which is helping fight the stigmas of not talking about that and being closed up about it. We've seen in person, it's really quite rewarding to see them open up and admit, I see a counselor, I take medication, I have anxiety. So it's that's the opportunities that are offered to us. And finally, the threats, we talked about the stigmas that we're hoping to overcome, loss of PCP providers and other specialties here in the region. We did experience some staff turnover, but we feel we have a strong team now. Trauma, we're ready to face the trauma that poses a threat that older adults have experienced. And of course, unfortunately, there's rising substance abuse and increase in suicide rates here in Winnebago.
All right, so we submitted 2 budget proposals. So the first one is kind of continuing where we're at now. So we realized that the 500 was just very lofty and aggressive. We didn't realize, the barriers that we were going to face when we started off. So we feel that 350 is a little bit more realistic. We still want 50 to participate in the program. We would like to complete 50 suicide risk assessments and have 50 perception of care, have 50 people change their minds when it comes to getting mental health treatment.
So it was recommended to us because we wanted to expand the program a little bit, that we proposed 2 different budgets. So here you'll see, proposal 1 is based on, as Krista mentioned, as is a supervisor, which Krista serves as, and an advocate. Proposal 2 adds an advocate because we really found that doing the screenings full-time and then enrolling people onto the program and then following up with them with the screenings and first visit, second visit, and so on to get through the program was becoming a burden to the advocates. So we would like to add an advocate and make that a more aggressive team. So this then is the proposal to adding an advocate to our team. And then, of course, the goals are increased with that extra advocate.
Little plug for our senior expo coming up September 23rd. Rock Valley College.
I guess I'm very excited.
Are there any questions?
Thank you for your time.
Yes.
I just really, more of a comment that this is the beginning of this week, the Surgeon General has declared loneliness
Yep.
as a public health crisis, and I'm wondering if that's going to be thought more about with your program in itself, because it really was startling what they compare it to. You know, it's such a life-shortening
Yes.
experience, and how people just really, you know, their quality of life no longer exists. So I was just pointing that out.
And we definitely see that in the clients that, you know, that we work with, you know, folks have kind of isolated themselves out of need for COVID and they just haven't come back out.
Mhm.
And Joy will be on the news commenting on, she got interviewed this morning. for
Channel
that, so-
17 did a story.
On the loneliness,
Yeah.
yeah,
So, yeah, we were able.
yeah, that's critical issues.
Yeah, it really is.
I'd like to congratulate you on your startup.
Thank you.
It's terrific.
Yeah, we're very excited. I'm very proud, you know, to be up here talking about the program and the work we did. And we're very excited to see where it can go.
Yeah, it's so needed.
If I could commend you for your presentation, you know, as a board member, the way you laid out your process, your target, population, your goals, you know, your budget. To me, it was very well organized and very easy to understand, and I now have much greater knowledge than I did before.
Perfect.
So thank you.
Thank you.
Thank you very much.
You'd give them an A.
I will. I will. You can do a tutorial for others.
That's
Chris, I have one question. Obviously, this program is very nice, very successful.
Right.
What about the people who are not successful? How do you handle that with your other employees over that? Somebody who doesn't quite make it.
Well, we've had a few who haven't made it. So, you know, we talked about the 4 that made it through the program. On the flip side of that, I believe that there were 5 who did not. And I believe out of that 5, 2 had health issues and 3 just didn't want to. I think our job, regardless if someone completes the program or not, is to educate. And maybe somebody's not in a place where they're ready for help right now, but they know about us. And maybe down the road, they may change their mind. It's kind of the whole.
Since I'm over 60.
Thank you very much.
Give me a
We
call.
appreciate it.
Yeah.
Yeah, very good. Very good program.
Thank you.
I didn't know that it existed. You're talking about the demographic, what kind of demographic you have? Do you have a breakdown?
Yes, we do. You look at it, so I give you the right statistics. So on page 4, we have the breakdown by gender, race, ethnicity, and marital status. Is that what you were
Yeah.
looking at? Yeah.
It's always amazing.
And when you talk about cultural competency,
Yeah.
what kind of training
It's
is
resources, you know.
That's right.
We have It's I'm blanking on.
The cultural
Competency, yeah.
We're able to, when we do outreach, to focus on those that are low English speaking. And have more brochures in different languages and attend outreach events where
But
there's some diversity.
cultural competency is more than knowing the language.
Right, right.
Uh,
We
Yes,
attend trainings
In
for
Rockford
them.
area, we have about 15% people who were not born in USA. They coming from different culture
Right,
and their what their needs are in terms of their values and beliefs. I mean.
Right,
Very-
yeah, we recognize that that can be a potential barrier.
Very good.
Absolutely, yeah, for sure.
Thanks.
Thank you guys very much.
Thank you. Okay, moving on to the monthly activity report. Jason, do you want to?
Yeah, thank you. As you can see, we had a very busy month of April with a lot of activity. While any one of those things will be important to highlight, I'd like to actually highlight a few looking ahead things for May. We have made a selection on a communications specialist, and announcements will be made this week on that. So be happy to share more information about that as soon as that process has completed. And I think it'll probably be part of our conversation at our June special board meeting, in which we're doing some strategic planning, because it's going to be a big part of the planning for promotion and awareness, that section, which I know we had a lot of conversation about at the last board meeting. So looking forward to sharing more about that as soon as we're able to. On May 5th, which we know is this Friday, NAMI is hosting an event that we are co-sponsoring, which is the Building Bridges. Encourage anyone in the community to attend, also board members to attend. One thing to note is that we will likely have more than, at the very least, more than a majority of a quorum of board members present, if not a quorum of board members present. So it is critical that there be no discussion of board conversation at the meeting. While there will be funded agencies there, cannot engage them in any conversations about funding decisions or anything like that. If asked about that, we can schedule meetings, they can contact me, meetings can be scheduled, they can come to a presentation to the board meeting, can come to a public comment to a board meeting, but we cannot have board conversation at this event because it would be a violation.
Hello, my name is, don't talk to me.
That might be why, yeah, about board
The back,
business.
Open Meetings Act.
You can talk to everyone there, shake their hands, say hello, but just no discussion of anything that's board business.
Excuse me, wait,
Yeah,
Nicole said it. You want to just comment on, and that's in compliance of the open meeting.
precisely, yes. It is, that would be a violation of the Open Meetings Act to discuss board business while there is a majority of a quorum of board members present in any location.
Yeah, thanks.
Yeah. It's not me just micromanaging everyone. Thirdly, in preparation for the special board meeting in June, we will be sending out a questionnaire to board members that is really modeling after a best practice called empowerment evaluation, which is a self-assessment tool for boards, generally speaking, to reflect on our own process. How are we feeling about the way we are operating as it relates to board values? How are we feeling as it relates to operating principles, et cetera? So that will be really helpful in framing some of the conversation for the June meeting. So appreciate everyone taking the time to fill it out. Shouldn't take that long, but we will send that out in an email. If not by the end of this week, then certainly early next week. And certainly if you have any questions about it, feel free to call me. Yeah.
What was that date?
May 5th for the
special meeting.
June 15th.
Okay.
Yeah, that's June 15th at 1 o'clock. I've held this meeting room here from 1 till 5. I don't imagine we'll need a full 4 hours, but that's what I've kind of allotted for, at least in case we have extensive discussion. There will likely be a few action items that day as well. We, based on my perception and experience of last year's county board timeline for budget approval, I think we need to approve our budget for fiscal year 24 at the June meeting, because last year they were asking for it for end of June, early July. And so I want to be prepared for that as well. And it, conveniently makes sense to discuss the budget in terms of our strategic plan as well. And then lastly, we will have, today is the deadline for the new applications for programs that were requested to file a full application based on their abstract. So I know you're probably starting to get a little bored over the last week without something to review. We will have great to have Mohammed join. That gives us an extra person to review, right? So based on our process, if everyone files an application, it's going to be 6 or 7 reviews per board member. Nicole, maybe you can remind us of the timeline of that. When is the deadline? Is it maybe about 6 weeks for reviews?
Yeah, and they'll be assigned on Monday. So I will give you the weekend to exist, and on Monday, you can enjoy the Derby, and then Monday. Yeah.
And that concludes my monthly activities report.
Thank you, Jason. Moving down to our action items, I'll need a motion for the April 2023 meeting minutes. Tim, thank you. Mohammed, thank you. Second. Well, I do not have to take a roll call for it. A vote, I can do it by ayes. So all those in favor? Aye. Opposed, same sign. Thank you. The second action item is the resolution 2023 authorizing the Winnebago County Mental Health Board funding and allocation of grant funds for continued funding applications for program year 2023 to 2024. So this does involve Jason, this is actually the approval of all of the renewals, correct? This
Contingent upon the execution of the work plans and funding.
Exactly. Okay. So the resolution will authorize the Winnebago County Mental Health Board funding and allocation of grant funds for the continued funding applications for the program year 23-24. Whereas the Winnebago County Community Mental Health Board published a 3-year strategic plan defining priorities and target population for program years 22 to 24 and released a notice of funding opportunity for program year 24, requesting proposals aligned with the strategic plan priorities for up to $20 million of the total funding. Whereas the Winnebago County Mental Health Board received 30 continued funding and 2 merged application requests totaling $17,637,288 million. And whereas the Winnebago County board members reviewed, evaluated, and scored the 30 continued funding and 2 merged applications according to an established scoring rubric, and was published alongside the notice of funding opportunity and developed recommendation for these organizations and program. Now, therefore, be it resolved by the Winnebago County Board as follows. The Winnebago County Board shall fund the following proposals totaling $15,583,097 contingent upon the execution, as Jason pointed out, the funding agreements and work plans. The following organizations will be funded: Boys and Girls Club of Rockford, the Youth Self-Regulation Program for $241,800, Children's Home and Aid Doula Program for $174,961, Children's Home and Aid Program, EPIC Program, $370,866, Children's Home and Aid Trio Program for $260,040. Circle of Change Youth Dog Program and First Responder Dog Program for $40,891. City of Rockford, the Crisis Co-Responder Team, $1,923,124. City of Rockford Mobile Integration Health Mental Health Program for $1 million, $1,166,914. Crusader Community Health, Crusader Behavioral Health Services continued funding for $614,000. Family Counseling Services, Northern Illinois Service Expansion 3 for $244,000. Lifescape Community Services Senior Mental Health Program for $159,115. NAMI Northern Illinois Support Education and Mental Health Advisory for $222,000. OSF Healthcare System DBA St. Anthony Medical Center for the OSF St. Anthony Medical Center Trauma Recovery Center for $315,000. Regional Access and Mobilization Grant Mental Health Services and Training for $308,000. Remedies Renewing Life CARES Program Behavioral Health Clinician Project for $169,896. Remedies Renewing Lives Domestic Violence Therapy and Advocacy Project for $32,000. Rockford Park District Foundation for the Unique Mental Health Services through the development of the Lockwood Indoor Equine Center for $525,000. Rockford Sexual Assault Counseling, the Outreach Therapist for $160,000. Rosecrans for the Rosecrans Access to Care for $2,968,000. Shelter Care Ministry, Jubilee Community Outreach and Housing Stability Program for $88,000. Stepping Stones of Rockford Counseling Center, $126,000. Stepping Stones of Rockford Expansion of Construction of Supervised Housing for Adults with Serious Mental Illness, $1,650,000. University of Illinois College of Medicine Rockford Care Program, Compassion and Appreciation for Recovery in Everyone for $327,000. Winnebago County Resource Intervention Center Behavioral Health Continuation for $183,000. Winnebago County Juvenile Resource Intervention Center Behavioral Health Continuation, $183,000. Winnebago County Juvenile Detention Center Reducing Isolation Through Expanded Behavioral Health Continuation, $430,000. Winnebago County Health Department Trauma Informed Community Care Coordination Continuation of $160,000. Winnebago County Sheriff's Office, Winnebago County Jail Behavioral Health Program Enhanced MAT Program and MAT Program Implementation for $1,714,000. YMCA Rock River Valley Protecting Youth Mental Wellness YMCA Year 2, $169,000. Youth Services Network the Youth Trauma Clinic for $568,000. And YWCA Northwestern Illinois Mental Health Crisis Care Manager for $133,000. So those are the recommendations for the funded programs, and I will need a motion. And if there's any question, our audience is comprised of we have the YWCA and we have Remedies and Rosecrans to answer any questions.
Those would be for the budget.
Oh, would it be? Okay. So they would not be answering questions about this.
No, they're here for the budget.
Okay, you have to
Budget
wait.
amendments.
You have to wait your turn to answer me. But I do need a motion in a second.
I move that the recommendation be.
Okay, Dick
So-
and Tim, okay? And since this is,
Tim, with the second.
Tim did the second. So there will be a roll call for this, Mary Ann.
Quick
aye.
question.
Oh, definitely.
Just wondering about, we're obviously public right now, but any other plans for public notification of these? recommendations, results?
There's,
I know that all of the organizations will be notified this week. We had not planned on doing a press release today because we have the NAMI event that's being promoted on Friday, but we could release one next week. For the purposes of, but we always publish it on the website as well.
And they're individually contacted via email as well.
Right. Just wonder if there'd be any public entity that would get out in front of us making an announcement that would come from us. I mean, maybe it's not a concern, but with those.
because the meeting is public and
Right.
they're welcome to, view this meeting.
Right,
It probably,
like if, not likely, but if one of the media was watching the meeting or something, they would be getting out in front of us. But I just wonder if, that process has probably worked fine in the past, and if there's no concern on your part.
have we had any concern about?
We haven't had that issue take place to this point in time. We've always made ourselves available to the media to answer questions about those, and we've always been transparent of publishing those decisions publicly. So I think if there are media watching that are wanting to make a statement about this, we'd be happy to answer questions to clarify any points on it.
Great.
Okay. So we did have a motion in a second, so roll call, Mary Ann Abadi, yes. Dr. Copeland, Dr. Terry Giardini,
Yes.
Dick Kunert,
Yes.
Dr. Bill Gorski,
Yes.
Wendy Larson Bennett, Tim Neighbors,
Yes.
Linda Sandquist,
Yes.
Mohammed Yunus.
Yeah.
All right, moving on now to okay, the resolution 2023 authorizing, thank you, Tim. Authorizing funded program budgets updates for program year 22 and 23. Jason, did you want to?
Sure, I'll give a brief explanation and then any more detailed questions can be directed to the agencies themselves. There's 4 organizations. As we kind of wrap up the program year, it is expected that we have more budget requests. Of course, agencies are evaluating where they have underspent and where they might need additional spending to complete their program year. This month we have and maybe I'll also make a note that per our contract, the June board meeting would be the final board meeting for which a budget amendment can be made for this program year 2023, which ends May. So there'd be one opportunity for a final budget amendment of something that could be maybe made retroactive that might be requested, but otherwise that will be the final one, and then we'll close out that program year fiscally. The crisis co-response team, Rosecrans, had some unexpended funds specifically in their occupancy line item because they were able to share occupancy through the public safety building, and therefore were requesting to reallocate some of that into training. Secondly, would be the Rosecrans Access to Care program, in which they were looking to move some of their unspent contractual dollars to cover additional direct supplies that were purchased. Winnebago County Sheriff's Office had spent less than expected on their contracted staff through Freedom Behavioral Health, and they had were a little under budget on pharmaceuticals. I think there's been increased costs in pharmaceuticals, and they've had increased need beyond what they originally intended. So they were looking to move $35,000 of underspending from contractual into pharmaceuticals for psychotropic medications specifically, to be clear. And then lastly was Remedies Renewing Lives, which had underspending again in their personnel. And most of that, correct me if I'm wrong, I think was due to revenue generation on some of their current positions. And then they were looking to move that into furnishings. They've got a great space that we went and witnessed at a site visit, but need some nice furniture to fill the space properly. And so those are the changes as noted in the resolution.
I move that the changes be accepted.
Second.
Any discussion? I just have a question. I thought for Rosecrans that they waived that occupancy because,
Correct.
okay, so,
It was waived because of their sharing occupancy at the public safety building, so we did not need to have the occupancy line item.
okay, and then I thought that that was
So,
redistributed.
yeah, there is still enough budget in their current budget, so this was approved by the city of Rockford as the lead agency. And so what Mary Ann's alluding to is that the city of Rockford has a work plan amendment that is allowing for a program director that will be 50% covered by the co-responder program and 50% covered by the mobile integrated health program. And it's a position that will be working across both PrEP programs to create more cohesion among our crisis response services. These two large programs that didn't really have a common staff person working across both. So we have communicated with them about what those costs are in both programs. And they authorized that they still believe this was appropriate, and based on our review of the budget, we believe they would still, in this program, you have the ability to do that, and we'll have to work with them on budget based on their approved renewal to make sure that's appropriately budgeted in their new program.
Okay, so you're telling me there is funding.
There is funding for
Okay,
that position.
all right.
This will not eliminate that.
All right, that's fine then. Okay, we have a motion for approval in a second. So I will do the roll call. Here's my roll call sheet. That's correct. Mary Ann Abadi, yes. Dr. Edward Copeland, Dr. Giardini,
Yes.
Dr. Gorski,
Yes.
Dick Cooner,
Yes.
Wendy Larson Bennett, Tim Neighbors, Linda Sandquist.
Yes.
Mohammed Yunus.
Yeah.
Yes. All right. And discussion items is the next agenda item. And what I wanted to inform the board of is that I received a call from the mayor this past week. And he is putting together a behavioral health advisory board. And he has invited the mental health board to sit on this advisory board, and it's to take a look at possible other grants that the city could apply for behavioral health, not, other than the mental health funding, tax funding itself. And then also their community leaders that he's invited and representatives from some of the major organizations. And he would like to be able to brainstorm about their vision for behavioral health and what needs that they see. This involves Mercy as well as Swedes, as well as UW. And so, and School of Medicine, the mental health board, Jason will represent the mental health board and sit on this particular committee. We did offer him the option because of our authority, we're able to put together advisory boards for our purposes if we need input from the community. And this would be a great type of board or a committee for us, advisory committee for us to have, because it would be direct input from the community telling us directly what they view the needs and the gaps and so forth. It's just more eyes and ears. Obviously, we have our strategic plan, our vision, our clinical model, so we're certainly not backtracking on what we're doing and looking forward to continuing. But we are open to participating. So I just wanted to let the board know that this is going on. There's no dates yet. But I'll keep you posted as I hear. I know Jason will. So, Okay. It is very interesting. Other matters, I have nothing, under other matters. So at this point in time, if there is no further comments or,
Move for adjournment.
okay. We need
Okay,
a second after Doris. Okay, all those in favor, please say aye.
Aye.
Okay, opposed, same sign. All right, well, thank you all for coming.